guys like Alrighty. Everyone's favorite, valgus varus, McMurray's and Apley's are the ones coming up next. So I'm assuming some of you guys had experience with this already. So again, just to make sure we're all on the same page, so valgus stress test mainly for MCL, but it does stress other structures as well. Keep that in mind. Positive test, pain and laxity or gapping. So at full extension, if there's laxity or if it opens at full extension, you probably damaged a lot more stuff. If you do valgus at 20-30 degrees and you find gapping, then some people say that you probably just did MCL, maybe posterior oblique ligament and posterior cruciate ligament as well. Okay, so at full extension, if there's gapping, you probably tore a lot of stuff. With varus, same idea. At full extension, LCL, posterior lateral quadricep, ACL, PCL, posterior capsule, and potentially biceps femoris. Now in the book it does say semimembranosus. I just put down there because that's kind of hard to visualize how. But if there's gross laxity, potentially might have damaged that hamstring as well. If you have the knee flexed and you test it and there's gapping, then relatively the same structures. Which one is more frequent? MCL. A varus force is rare because your other leg is in the way. The next two, or actually I think we'll do a bunch. Okay, so valgus and varus. We've got Apley's. The patient is prone. There's a picture there. And there's compression and there's distraction. So one, if you compress, it confirms one thing and unconfirms the other, and vice versa. We're talking about the menisci and collateral ligaments. Okay, so if we do compression and there's pain, it's positive for meniscus, but it rules out the collaterals. If you distract, if you apply traction, we'll say, it tests for, so now you're stretching the joint, stresses what now? Ligaments, but it takes pressure off the meniscus. Okay, so it rules one thing in, it rules out the other. Discomfort, excessive movement, restriction indicates compression with rotation, meniscus injury, distraction with rotation, ligament injury. Internal rotation typically tests which meniscus? Lateral meniscus, and vice versa, the opposite. I don't know if you figured this out with this locums test, but if you internally rotate, if you externally rotate the tibia, which collateral do you think you'd stress more? Sit there with your knee at 90 degrees and turn your foot externally. What side stretches more? Okay, so you're testing the medial collateral ligament with internal rotation. Sorry, with external rotation. Okay. So external rotation, MCL, and medial meniscus. Internal rotation, LCL, lateral meniscus. The most important thing on this slide is right here. That's the latest and the greatest. Sensitivity increases significantly if 2 or more tests are positive. Even more so with the joint blind palpation test. A lot of therapists now don't even do Apley's or McMurray's. They just palpate the joint line. If there's pain, meniscus. McMurray's test. Now there's several variations of this. Some people have them at 90, internal, external rotate. That's just like Apley's. You can apply a longitudinal force on the heel, but why not just have them prone and push down? If you don't want them to flip over so much, you keep them in supine, and you can do a modified Apley's, which looks like a McMurray's. Now in some books, you can add other elements to McMurray's, such as valgus and varus. If we're going to test the lateral meniscus would you apply valgus or varus force? How many people say valgus? How many people say varus? Ooh, debates. We're testing lateral meniscus. Think about what action will pinch that meniscus. If I go this way, which sides of the bones touch and which sides spread apart. And if I push on this side, what happens as well? So think about that when you do your testing. Okay. So with McMurray's, how do we test for lateral meniscus again? Internal, external rotation. Internal rotation. How do I pinch the lateral meniscus? Valgus or varus? Valgus. Apply valgus with rotation. Now you potentially stress the meniscus, the lateral meniscus, even more. Here's another note to make. If you do this stuff in closer to extension, it's typically anterior meniscus, anterior horns. Sometimes you might hear that. If you test with these elements and add flexion or deflection, it's the posterior horn. Okay. Think about what happens during the screw-hole mechanism in extension and flexion. Where are the femoral condyles on the tibial plateau in flexion and extension? If I go like this, and the femoral condyles roll posteriorly, they're going to have to glide forward at some point to continue to flex. With that rolling, the condyles are rolling onto the posterior aspect of the menisci, which is why McMurray's at inflection tests the posterior horns. Does that make sense? Okay. So, flexion, extension, internal, external rotation. Flexion, extension, posterior horns, anterior horns. Internal rotation, what meniscus? Lateral, medial? Internal rotation, lateral meniscus. External rotation, medial meniscus. Good. Valgus or varus? Valgus is which meniscus? Lateral. Varus, medial. So you can add those elements. I would suggest you start off with just one element first, flexion, extension. Somebody mentioned that their athlete, it said, they told me they're painful in full extension. Could that be meniscus? Absolutely. What part of meniscus? Anterior. Maybe add some rotation with extension and flexion. Then add valgus and varus. And then you'll see some supervisors that actually combine it in this mixing bowl type of movement, which you can do as well. I don't recommend it off the bat though. Just do one element at a time, and then start combining them when you feel comfortable. Painting, clicking is what you're looking for. So again, let me know if that hurts. Give me a number out of 10. And feel for the clicking. I don't feel clicking. I do feel clicking. Make sure you verbalize that. And again, sensitivity increases when you use more than 2. Questions about McMurray's? Joint line tenor. So you're just palpating the joint line. Start anterior and work your way all the way around. Okay. This is here for a reason, because if you sit there and internally and externally rotate your leg at 90 degrees, you'll find that you'll expose one tibial plateau more so than another. Then you take 90 and externally rotate. Which tibial plateau comes more forward? External rotation. Medial comes forward, so that should expose more area of the menisci so you can poke on it a little bit better. So that's why you can add internal and external rotation with this palpation test. Okay, now the last one I'll talk about is side and then we'll have an opportunity to possibly finish off the rest of the class just practicing. Okay. Stuyvesant test. People get this confused with meniscus pathology because the pain here is on the joint line as well. Now, the question is, does it make a difference? Like, is my treatment going to change? Possibly. If it's a meniscal issue, it's cartilage, which means it might need some surgery, especially if it's the inner third. because that doesn't have a blood supply. Is it possible to stretch the ligaments that hold the meniscus onto the tibia? These meniscal tibial ligaments? It is. It's possible to sprain those, in which case it's a ligament. You manage it like a ligament sprain your ankle. You do frictions, ultrasound, that type of thing. But then how do you know what's the difference between a meniscal injury and those meniscal tibial ligaments? What happens to the menisci when you flex? What direction do they move as you flex? As you flex the knee? Posterior, anterior? Posterior as you flex. It's called the cherry pit mechanism, correct? Okay. So remember the roll and the glide as you flex. The femoral condyles roll backwards. They'll pinch the posterior horns and slide the menisci back as well. As you flex, what muscles are working? Your hamstrings and your popliteus, which both attach onto the menisci. So when those muscles contract in the back, they'll pull the menisci backwards as well. So long story short, the menisci move as you flex and extend. If I palpate joint lines with knee and extension and they go out, if they flex, if it's meniscus, what should happen when I palpate again? Should the pain disappear or should it stay? If it's meniscus, it should go away because the menisci just, they move back, so you can't palpate the menisci anymore. So if it's meniscus, the pain will go away. Do the meniscal tibial ligaments move? They're attached to the bone. So if it's painful in extension when you palpate, and it's painful in flexion when you palpate, it's the meniscal tibial ligaments, because they didn't move. Does that make sense? Okay, so this is my menisci. Oh, that hurts. As you flex the knee, the menisci move back. If I poke on it again, oh, that still hurts. Well, it's not the menisci because they moved out of the way. It's the meniscal tibial ligaments that are still there. Okay. Let that simmer a little bit. It's a lot more. Yeah, so the question was, can you test the posterior horns of the menisci by going from flexion to extension? You could, but you have to dig through the popliteal fossa. So it's not as reliable because there's all those other things you're poking through. So is it meniscal tibial ligaments or is it the popliteal muscle you're poking on? That's painful. So it is kind of hard to tell. I mean, you can rule that out by doing manual muscle testing. But it is a little more difficult because you're poking through more stuff. Through the anterior, it's just skin, fat pad, and then the bone. So any questions about Steinmann's? Okay. Can I erase this, by the way? What are you guys doing today? Okay, so for the rest of class, we got Steinmann's. Athletes, McMurray's, Zalgas and Maris.
Yeah.
Okay, so we got Steinmann's, joint line tenderness, McMurray's, Apley's, Zalgas, and Veris. We've got all those. Joint line is just palpation. Practice those. If you need to practice the ones we did previous to that as well, practice those as well. If you're done with those on your partner, then do it on somebody else. We will be done in about